Good morning. Thank you for joining us today. I'm Mark Thomas. I lead the Pittsburgh Regional Alliance. Welcome to the latest of the conference's Response to Recovery webinar series. I'd like to thank our sponsors for making today's event happen. That includes Peoples, Giant Eagle, PNC, Highmark Health, and UPMC Health Plan. We'd like to also thank the Allegheny Conference's regional investors who provide the time, talent, and resources for us to make this type of programming happen. Today's webinar is a conversation with Loren Sweatt, who is Principal Deputy Assistant Secretary of Labor for the Occupational Safety and Health Administration, also called OSHA. The pandemic has obviously created widespread disruption across the country. Our region is no exception. As employers come to terms with a new normal, it's critical that they have the guidance on ways to continue to operate safely and in a manner which employees feel protected from the coronavirus. That can be more important. Today, we'll hear from an expert in workplace safety to learn more about workplace guidelines and regulations that can help companies operate until effective virus mitigation methods are developed. Our guest speaker joined OSHA in 2017 after more than 15 years at the U.S. House of Representatives, where she served as a senior policy advisor at the Committee on Education and the Workforce. In this role, she handled workplace safety issues before the Congressional Committee, which included her current agency in the Mine Safety and Health Administration. She holds a BA in Political Science from Texas Christian University and an MBA from Marymount University. After her presentation, we'll facilitate a Q&A with those in attendance. At any time during the presentation, you can submit questions using the Q&A function, and we'll do our best to answer as many as possible. Without further delay, please welcome Loren Sweatt. Thank you.
Thanks, Mark. Thank you for inviting me to participate in today's webinar. I'm encouraged to see that the Allegheny Conference has hosted a series of webinars to help employers and workers throughout your region in these challenging times. It's my pleasure to speak to you today about OSHA's resources to help maintain safe and healthful workplaces. Although we are not gathered together in one location, we are still able to stand together in our shared commitment to protecting the safety and health of workers in your region and across the country. It is crucial that OSHA has a good working relationship with our stakeholders, and I hope that this meeting will continue that positive collaboration. 2020 is significant year for OSHA. It marks 50 years since President Nixon signed the OSHA Act into law. In its first half century, OSHA has helped transform American workplaces into safer, healthier places. While recognizing the many significant advances in worker safety and health over the past 50 years, the agency must remain laser focused on the present and the future. The nation is currently facing an unprecedented crisis, a pandemic that continues to impact much of the workforce. This is not how we expected to commemorate the 50th anniversary of OSHA. However, the importance of worker safety and health and the agency charged with assuring workplace safety has never been more important. As our nation continues to battle the spread of COVID-19, many of America's workers are on the front lines. This includes many workers doing a variety of essential jobs throughout your region. OSHA is working hard by providing guidance and information and responding to complaints to assure that these workers are protected during this unprecedented challenge. OSHA is collaborating with other federal partners to ensure a coordinated approach to reduce workplace exposures and ensure a unified federal response to COVID-19. OSHA's message is clear. Employers should have a plan for protecting workers and preventing further spread of disease, as well as maintaining the employer's day-to-day functions. Employers should ensure that workers are using proper controls to prevent exposure to coronavirus. These include physical barriers to control the spread of the virus, social distancing, and appropriate personal protective equipment, hygiene practices, and cleaning protocols. OSHA recommends that employers consider sick leave policies that are flexible and consistent with public health guidance. In these policies, employers should actively encourage sick employees to stay home. They should also be aware and plan for employees who may need to stay home to care for sick children or other family members. OSHA has also issued return to work guidance that addresses important issues employers need to consider when returning workers to offices and the resumption of other job duties. During each phase of the reopening process, employers should continue to focus on strategies for basic hygiene, social distancing, identification and isolation of sick employees, workplace controls and flexibility, and employee training. Non-essential businesses should reopen as state and local governments lift stay-at-home orders and shelter-in-place orders, and follow public health recommendations from the Centers for Disease Control and Prevention and other federal requirements or guidelines. Employers should consider ways to use workforce flexibilities such as remote work and alternative business operations to provide goods and services to customers. OSHA recommends that employers continually monitor federal, state, and local government guidelines for updated information about ongoing community transmission and mitigation measures, as well as for evolving guidance on disinfection and other best practices for worker protection. This guidance is available on our website. I encourage everyone to review this guidance and apply it as appropriate to their work sites, and ask for your help in sharing the agency's recommendations as widely as possible. Events such as this help contribute to that. OSHA has ramped up its compliance assistance and enforcement efforts to help prevent the spread of COVID-19. This includes initiating inspections in response to general complaints, referrals, and whistleblower complaints related to the virus. OSHA is making every effort to get the word out to employers and workers about agency guidance and other important information. The agency's coronavirus webpage contains the latest information and guidance and is easily found on our homepage at osha.gov. OSHA's COVID-19 webpage provides information on a wide range of industries, including those workers at highest risk of exposure to the virus on the job. The agency is also developing industry-specific one-page alerts with information on how best to limit exposure for workers in certain jobs, including about 19 different specific industries that we have. OSHA's homepage highlights a COVID tip of the day that focuses on important information to prevent worker exposure to the virus. OSHA is highlighting COVID-19 resources and publications, press releases, social media, and the agency's Quick Takes newsletter, which has more than 293,000 subscribers. Many of these resources are translated into Spanish and other languages. OSHA's poster on reducing risk of exposure to the coronavirus has been translated into 12 additional languages. The poster highlights 10 infection prevention measures every employer can implement to protect workers' safety and health during the pandemic. OSHA also published a short video and a poster on 7 steps to correctly wear a respirator at work. This poster is in 14 languages. The video and poster demonstrate and describe steps every worker should follow when putting on and taking off a respirator. More information about OSHA's guidance and resources for workplaces is available, as I said, at OSHA's homepage, osha.gov. OSHA also encourages employers and workers to closely follow the CDC's latest guidance on the symptoms, prevention, and treatment of COVID-19, and that's available at cdc.gov. Going forward, OSHA will continue to fully and fairly enforce the agency's standards. The agency will continue to develop and distribute resources to help keep workers safe. OSHA understands that working with stakeholders is the best way to achieve the agency's mission. And one way that OSHA works with its stakeholders is through the agency's national campaign initiatives. For example, OSHA's Safe and Sound campaign encourages employers to implement an effective safety and health program consisting of management, leadership, and worker involvement. It is imperative that these concepts are the cornerstone of your safety programs. Safety and Health Week 2020 was held last month, where employers and workers took time to discuss the importance of having effective safety and health programs and share ideas and best practices about how to manage them. I'd like businesses in your region that participated and encourage any that did not to go to osha.gov for more information about the campaign and to participate next year. But safe and sound is not just a week. It's something that you can do year round, and we have tools available on the website to guide you with this. The National Stand Down to Prevent Falls is happening this week. This is a voluntary event for employers to talk directly to workers about fall hazards and reinforce the importance of fall prevention. While the campaign's focus is on preventing falls in construction, falls are a concern for workers in every industry. Again, I thank businesses on the webinar that are participating and encourage those that have not to participate or look at the information about fall prevention and this campaign on the OSHA website. Thank you again for inviting me here today to participate and for your efforts towards keeping workers in your region safe and healthy. I would like to close by asking you to provide us with feedback, particularly on any ways the agency can improve its outreach efforts. Please let us know if there are products that you would like us to produce, whether on specific hazards, additional languages, or in a different format. Your feedback will help us ensure that OSHA is doing everything it can to help protect workers in your region and across the nation. Please encourage everyone in your region to stay up to date with all of the resources available and actions for keeping workers safe. Employers and workers can find all of this valuable information, again, on OSHA.gov by signing up for Quick Takes and following us on Twitter. Let's continue doing all that we can to send every worker home safe and healthy at the end of every day. Please continue to stay well and keep your workers safe. Thank you very much. Allison tells me we're going to answer some questions.
Yes, thanks so much, Loren, for all the helpful information. We really appreciate it. A couple of questions have come in, and again, for everyone, if you have questions, you can submit those through the question function. I think to start, can you tell us a little bit about how many times have you had to update guidelines since the pandemic started, just to give people an indication of, as you're receiving new information from the CDC, what that process looks like?
Sure. So it's been an iterative process. We started in March with our general industry guidance, and we've worked to narrow, not the guidance itself, but industries to really target what specific industries need. And so we're up to 19 industry guidance documents at this point. And then around May, we recognized that a lot of people were attempting to return to premises, not just to return to work because people have been working. Mission essential workers obviously have never left. And so we put together our return to work or return to premises guidance, which was available starting in June. And I just think that we've been trying to produce as much information as we can and update our safety and health topics page to keep it aligned, as we say, with the entire federal government and the recommendations that are coming out. And again, a lot of those change on a daily basis.
Sure, thanks. So we have a lot of people in healthcare and education specifically on this call. Can you talk a little bit about guidelines specific to those industries? Obviously, they're seeing a lot more traffic than a typical office space might be doing as people are slowly returning to work. So can you speak to those industries?
Sure. So for healthcare specifically, very early on, we recognized that there was access to PPE issues and supply chain issues. The president directed us to look at respirators specifically, and we've issued guidance on 5 different issues related to respirators. And our goal on all of those was to ensure that we can maximize the supply while also protecting workers. So it's been a very important aspect of what we've been trying to do to address the pandemic. And at schools and education, whether it's higher education or K through 12, CDC has been exceptionally active in this area, providing information and updates. And I think you will continue to see that, especially as schools consider how they're going to return. And in the higher education space, they obviously have the communal living issues. And so people are very focused on trying to get the best information into the hands of folks who are educating our children.
Okay, great. Thanks so much. And I know you gave quite a few resources as you were talking through a couple of websites and things like that, and that a lot of this information and guidance is based on a state-to-state basis as well. So can you speak a little bit to the federal guidelines and then how those apply or maybe are in conflict with different state guidelines and how people can find the right information?
Well, I hope that they're not in conflict. That's the first thing. Where they are in conflict, I would really encourage people to let us know. That's the first thing. Let CDC know if there's an issue, because we do need to work that out. And I recognize, I want to say I recognize for businesses, you're trying to run your business on a regular basis and you have all of the federal requirements and the state and local requirements that you had to address pre-COVID. And now with this overlay of extra material, it's certainly an issue that it's a challenge to run a business on a daily basis, and it's exceptionally more a challenge to run a business as the information grows on a daily basis related to COVID. So we're trying to put out the best information in the easiest format that we can and get that into the hands of employers, and then take the pieces of our guidance for employers and move it into usable chunks of information for workers. So the poster that I talked about and the respirator videos, we have all of those things available and in multiple languages, so that employers can take these things easily off the shelf or off the internet and provide these to workers in a safety minute, a safety talk, whatever your plan is of making sure that your workers are aware of what they need to be doing to keep themselves safe on the job. We work with our federal partners at CDC and across the government to try and get those identified as quickly as possible if things change. And so hopefully there's plenty of information that is readily usable for employers. But if there's something that you think we haven't covered, by all means, we're very interested in making sure that we write that in the best possible way and get it back into your hands. And the other piece of this, I really want to encourage folks to look at the legitimate government websites. There's a lot of information out there, and there's a lot of misinformation out there. We at OSHA have done the best we can to try and make sure that where we see something that's not actually an OSHA standard or not actually an OSHA position, to try and make sure that we have something on our website that says, no, really, this is what we expect from employers.
And so what is the best way if people have questions or if they need, I know people kind of feel sometimes questions go into a black hole and they don't necessarily get a response. So where do people reach out if they have questions where they can speak to someone or get some feedback?
Sure. So I know in Pennsylvania, I believe we have 5 area offices. So the first place you might want to start is your backyard. We have a lot of very dedicated personnel in your state. And so if it's something that you think that can be handled locally, I think that's one way to get some sort of instant answer, if you will. If it's something that you think is more of a global issue, you could certainly pass it back through the folks that you all have been working with to set this up. And they're the ones that are responsible for putting together a lot of our information. So they would be able to respond pretty quickly. And I think we're gonna, if we have become a black hole, I'm gonna fix that. But I do believe that we're trying really hard to respond as quickly and expediently as possible to the information requests that we're getting.
And that was certainly not an indictment of OSHA. I think just throughout this process, I think to your point,
well,
there's a lot of information out there and it's challenging to find the right places. So I think we can certainly share some resource links with all the participants today to really help guide people toward those sites that you mentioned. I think that is it for questions. So we are able to give everyone about 30 minutes back, but I know Mark has some closing remarks and information about what's coming up next from the series as well.
Great.
Awesome. First, thank you so much. These were great insights, and hopefully our audience found this helpful. I'd like to also thank our sponsors again, Peoples, Giant Eagle, PNC, Highmark, and UPMC Health Plan for their support. Just a reminder that you can always visit the Allegheny Conference website for links to our COVID response information, Ready Pittsburgh, and other resources that we hope provide support for your reopening and recovery. Stay on the lookout for future recovery invitations, and we hope you have a great afternoon. Thank you.
Thank you, everybody.